Let's take a look at the eye gel or supraglottic airway. The eye gel itself is an advanced airway method which requires practice. So before this is actually used, practice and insertion and measurement needs to be undertaken. You'll notice we're using a size 4. The actual eye gel, it says, has the size written on the tube. It also has the size written on the carrier, and they are also colour coded: red, yellow and green. Sizing goes 3, 4 and 5. 3 small adults, 4 medium-sized adults and 5 large adults. Sizing is important because of the size of the glottic airway to fit the actual laryngeal mask itself. So let's have a look at it. We take it away from the actual carrying case itself, and it comes away quite simply. And the carrying case is important because we're going to use that in a second. It has a heat activated rubber airway. This actually swells very slightly under warmth, so when it's inserted into the airway itself, it slightly warms, it slightly swells to actually fit effectively across the top of the airway itself. It has a central lumen or a hollow centre, and at the top there is a fixing or a fitment point for fitting the airway. So the catheter mount itself fits on top of the tube to give us a good airway directly into the lungs itself, and on this end would be where your oxygen system fits, either your bag and mask or the ambulance vehicle oxygen system. It also has at the top end a small hole to the side. That small hole is for suction. There is a small pipe that runs all the way down the side of the eye gel and comes out at the tip of the eye gel as a little suction point. And that is used with a very fine catheter mount inserted down the tube to suction any fluids that gather at the head end of the airway itself. It's a very soft, supple rubber apart from the bite block, and at the end where the teeth fit or the teeth go, there is a solid plastic insert to stop the patient biting through the tube, to stop the tube actually effectively putting oxygen into the patient's lung. These are used far more commonly these days with paramedics out on the road, and they can be used by FPOS qualified people, but they're far more used now than tubes or intubation because they're much quicker, they're much easier, they're much faster to insert. To insert them and to use them, what we have to do is first of all lubricate them. So when they come out of the packaging, they are sterile, and we don't want to touch the area that's going into the back of the throat at any time, because that will contaminate it, and that contamination will be putting down the patient's throat. And it requires a lubricant. The lubricant itself is squeezed in a small amount, and we only need a small amount onto the actual carrier that the eye gel comes in. With gloves on, we actually hold the eye gel in the palm of the hand so that the tube fits into the palm of the hand, which is gloved, and the finger fits to the beginning or the start of the eye gel, and there is a little nodule for your finger to insert behind, and the airway is then straightened in the hand. We then lubricate the tip of the eye gel itself so as it will slip into the airway nice and smooth. Again, we're not touching the airway, we're using the actual stand and the gel to lubricate without any contact whatsoever. Once it's lubricated and the lubricant is covering all the outside edges, we don't want to apply too much lubricant, just enough to make it slippy so as it slides into the airway, and we will show you how to insert it later.